Welcome to the Disaster Case Management Training. My name's Jim Eyre. I'm from Visionlink. I'll spend the next 90 minutes with you providing a quick overview of the system. We'll look at the rapid intake tools, and then we'll pivot to the larger disaster case management tool. We'll focus on the technology, not the case management world. That training will be separate, but I will include things that are certainly relevant and part of that case management process where appropriate. The reason for the separation is because obviously that's hours and hours of training, and our role in this is we're on the technology. So we'll focus on the technology, and this time is for you. Marcia, I don't know what your preference is. You can use the chat box. I don't think you can raise your hand in Zoom.
Yeah, you can.
You can? Oh, okay, great.
From the reactions, there's a raise hand and lower hand.
Let me see. Maybe because I'm a presenter, I'm not seeing that.
Yeah.
Or if you just want to, interrupt, feel free to do that. Whatever's best for you. One programming note: there is a public access form that we won't be reviewing so much today, but just a quick note that this will be public facing. It'll allow for us to for CADRE to collect initial damage, risk, and impact assessment. These are largely be drawn upon the fields that you'll see in the rapid intake. So it'll be a very quick form. Hopefully we're wrapping that up tomorrow, and we can set up a separate training, or perhaps that's something that Marcia, since it should be simple enough, you can sort of focus in on that. Did I miss anything, Marcia? Anything else we're trying to accomplish or do? We're going to go through the forms. We're going to go through how to search. We'll go through all the sort of high-level overview of the forms, and we'll keep it open for questions. Does that sound about right?
Yep, that's good.
Excellent.
I'll monitor the chat in case there are questions.
Perfect. And then let's see, that might be too big. I'm trying to. How is the font size, Marcia, on the Zoom? Is this good? I just want to make sure if someone's watching the video, they're able to get the most out of this.
Looks okay to me. How about everyone else?
I'm seeing a little there. Thumbs up, 2 thumbs up.
Okay.
Love it.
Yeah,
Great.
just let us know if it seems like it's too hard to read. We'll modify it again.
Exactly. So a little bit about Visionlink technology. We have a suite of disaster tools, one of which is disaster case management, called Client Connect. That's why you're seeing here. This is all role driven throughout Visionlink. Our technology allows to take the database structure and put it in a web interface. So you're able to see. So all of this is HTML, these pictures, all this can be changed. It's also role driven. So if you have access to Client Connect or one of the other modules, you may see additional buttons. When you go to the Client Connect landing page, you may be a supervisor and you will see different tools. I have everything here, being a super user, so it's a little bit more than most will see, but hopefully it all makes sense. We organize our landing pages largely around actions and the information. And the actions are typically the buttons that you push to go places. The information can be anything like training videos to downloads to they may be lists of in our gifts in kind module, they might be lists of offers or agency requests. We may set up landing pages that have tailored to your caseload, right? There are different things that we can do. It's all role driven. It brings together the visual part with the data part. So it really does allow for us to do a lot of things to support the great work that you do every day. You'll see here up at the top, they'll say your name. There'll also be a place for your profile so you can check in information, see a little bit about yourself. In California, there are 2 main forms that we're going to look at. One's the rapid intake, and the next is the disaster case management form. This is the form that aligns with FEMA's Individual Assistance Program for Disaster Case Management. and allows for you to capture everything related to impacts, the programs, the assistance they've received, record referrals, and build household structures. And we'll walk through each step of that. We also have a case structure at Visionlink. So what this means is, let's say Marcia's family is being served, and she creates a public access registration, or however your intake form, however you're looking at that. You can then open that public access form as a rapid intake and complete intake that way. You may, once you've completed intake, you can then open that case in the longer full disaster case management tool. So what this allows for you to do is to have different views of the same record. So any information that's stored in any of those fields and any of those forms, if they're common to one or two of the forms, you'll be able to view that and edit that across all forms. We also have, and we won't go into this, but we've also set up call center tools that are available, just as an example, to allow for if call center agents end up doing some of the intake or outreach. So let's just dive in right now, and we'll go through. And this is the rapid intake. You'll see here, we've got buttons up here to save and to view the household structure. We have tabs that organize the interview and the referrals. As you'll see, as you move down, you have first name, last name. You have standard conventions like a red asterisk, mean it's required. We also have fields that have a wheel. These are smart fields. So if I select that, I'm going to unselect it. Those fields go away. This allows for us to optimize the desktop and the user experience for the case managers, only seeing the things that are related to what this client and what they're working with. They're also ordered into subsections. So here on the rapid intake, you'll see, and I can click on the headers and they collapse. And you might want to do this as you start an interview, or you might want to do it as you complete sections in an interview and close them out, depending on how your interview process goes. But we're going to go ahead and we're going to open up the first subsection and just enter info. And we're just going to Jane, we can leave middle name blank, queen, female, date of birth. You'll see here, we can't select dates in the future. But what we'll want to do is select the year and the month, and then select the number. I'm going to do that again, because if you're not selecting, today's really easy, but if you go back, like our son's birthday, I'm selecting the number. Some people get a little tripped up on that. You just select the number and that clears it. You can also manually type and then hit enter, and that will also allow you to do that. It's really your choice, what your preference is.
And this is Marcia. Can
yep.
you just do that one more time? Just because on my Mac it acts weird. Do the pick the month and then the date.
And you do need to format it in this order. So it has to be slashes have to be the same, and it has to be month, day.
Okay, so
year.
I didn't see you do it though. So pick from the calendar, month, not year.
Oh, I see.
Yeah.
So June.
Month, day, not year.
Well, you have to select
You
in
have
this
to select
sequence.
year before date.
Yeah, the date is the
Okay.
last thing.
That's
'Cause if you-
important. Yeah.
Yeah, so if you select, let's say you go in and you select June 12th, it's going to automatically select the year.
Right. And we tried to fix that.
This is how all of our systems are set up for all of our customers. It is the standard format. I'll see if there are ways in which development can look at that, but it is a standard interface for all of our customers. You can also do the 06-112/2012.
Okay.
and then hit enter. Both work. Now you'll see here, you had on-screen validation. So this field, best phone, it needs to be filled out. And oops, I got more messages because I put in information that says it has to be a valid phone number. And then it gives me available options. If I want to, I can do a 1 in front. That is a valid number, or I can take it off. Trim that. You can put in the email. Same is true here. There are validations that messages that pop up. You can select the preferred language other than English. So English not on the list. So you can select Spanish. And it's configured for multi-select. So if someone, French and Tagalog may be a combination that you see in your area. You can also select it and it will retain the order that you selected. So from a program perspective, if you are supporting multilingual households and there's a preference, you can put the primary one first. I'll leave that for Marcia, but just slowing out as a suggestion. Now we'll move on to the next area, is housing information. These are all available options. We're going to go with somebody is in that they rented, and we'll go through and Avenue and Boulder. You see it's a type ahead, and typically it's about 5 or 6 entries, and I've got the full address and it fills out the rest. This is an address I worked at for a number of years in DC. Because it is the district, it does not pull out the county. It is in the county. And then here you can put the same. And then you can also put in the current address. Same rules apply. You'll see that one selects most of your addresses will auto select the county. I think Washington, D.C. and some rural addresses you may have to look. It is not configured as a required field, so you could omit that. And that's it for the addressing information. So now we're on step 3, the client recovery needs. These are categories of advocacy. Throughout the case management process, there are ways in which you're serving different segments of different populations impacted by a disaster. Think of these as tags. These let you know that someone has access and function needs, so you can coordinate with disability integration. Maybe someone has children youth services, so you can coordinate with Catholic Charities around youth care or any of the other agencies active in your area. They're all fairly straightforward, and they're really designed to be quick tags to identify issues that a case manager can help advocate for additional resources. These client recovery needs will come up again as you're searching for referrals in a moment here, as well as when you're building a recovery plan with the case manager, or sorry, with their client in the future. So we're going to go ahead and
the question.
Yep.
Yes, I had a question about where you put in a little bit before the applicant rents. I was wondering if that's related to the pre-disaster address or the current address, because it's helpful for us to know if they owned the home that burned down or if they rented it.
Yeah, so
okay, got it. Perfect. Thanks.
Then this is the current situation. Perfect.
Got it. Perfect. Thank you.
Yeah, and then so here we're back to identifying vulnerabilities. You've got the client's recovery needs. There may be some program guidance as to when you select these, but certainly so many of these make a lot of sense in terms of services that might be available in your community. I should acknowledge the work of the National Disaster Case Management Committee, as well as the work of under Carol Flores and the team in Project Comeback in Texas for defining and refining the client recovery needs sections, categories to align with all the different kinds of areas of service that are out there. So as you'll see throughout our system, all of these fields, all the indicators, all of this has been aligned directly with the voluntary sector, and they've informed all of these fields. And many of these fields will also appear in the case management form. So as you're getting a thumbnail sketch on day 1, you open it up on day 21, or whenever you're beginning to serve clients in cases for recovery under true case management, that information would be embedded within the record. Next, we're going to be able to capture some case notes.
Sorry,
Go ahead.
this is Marcia. Question on the number of household members. I just want to ask those on the call if you're good with just a total number, or if you want it broken out, adults, children.
Now, when you get to the larger case management form, it does collect and break those out by children and adult. On this form, we can certainly add those same fields here, depending on what your intake and screening process is.
Yeah, I think it depends on how much information we need up front or would be helpful up front, because we could do adults, children, we could say household pets. That might need to be addressed, but I don't know. I'm not a case manager, so I'm just asking.
Okay, hi, I can reply to that. I think as a total number of households, I think it's okay to have like a general number. And then if Jim is saying that we are gonna provide more information, in the next, I guess, assessment, I think it will be fine.
Okay.
But that's me. I don't know everybody else.
Excellent. You can solicit feedback, in the days and weeks to come, and maybe there's, some value in that. Maybe you're trying to identify, different child services sooner rather than later. We do have the recovery needs, but there certainly might be value in being able to push a button and say, how many total kids are we serving, right? So certainly is value there. You let us know, and we can certainly add that field. We could also add additional indicators here around, for any specific vulnerable populations you have there, or services that you're trying to ensure are sort of pre-screen some eligibility around, maybe kids under 6, or kids who need diapers, or any of the sort of typical things you see. Being able to capture that sooner. The system's very flexible, and the real challenge there is change management. Make sure we capture all the feedback that folks have up front, and then figure out how do we schedule those conversations moving forward and update on a sort of managed basis rather than onesie twosie updates. But more on that as from Marcia and others. Here we have the case notes. Again, not stepping into the case management world, but typically case notes are designed to capture high-level observations, next steps, challenges. You'll want to avoid legal information such as the Social Security number, driver's license number, and those sort of other PII. Want to refrain from recording medical diagnoses. Maybe someone's, is COVID positive. It may be better to just capture different information around that they're in isolation, they're suffering from a cough, but leave it to the program guidance around what's the best way to handle that. Then we have yep.
Just move step 4 above step 5.
Yes.
Thanks.
Apologies for that. We'll go into the household expenses, and then the monthly household income. You'll see this is formatted. Like that, very straightforward. And then finally, it's the case administration you go through. You've got a verbal affirmation. and you're able to select the date, select the status. If they're just, maybe they're touching base and they want their information, but you've made some quick referrals and their all needs are met. Maybe they're ready for referral. You can select the event. There will be different events here. And then you can go ahead and select the initial interviewer, and you can select the organization. You can upload client documents. So there you would be able to capture utility bills or maybe photos of the house, the impacts. If you're using it on mobile device, all of our forms are mobile responsive. And if I roll this up to the top, you'll notice that the interface changes to adapt to a smaller device, right? Where you've got a handheld object and that you're trying to, this will turn into a camera widget on your phone or tablet. Any smartphone would allow you to take photos directly from here. You can upload multiple documents, and it also supports zipped archive files. So if you're working with someone, you've got a bunch of, different photos that you want to upload, you can put those together in a zip archive. It's a little bit more advanced to do on a smartphone, but on a desktop, that is one way to get around. There is a limit of 10 files that can be uploaded there. And then finally, you've got the release of information form has been uploaded. This is also where you can upload that directly into the system. I'm not sure exactly, Marcia, what's the process there? Is it going to be a PDF, or are you going to photograph with your smartphone device? How are they going to upload the form?
We have not discussed that. I'll add it to the list.
Excellent. So both options are available. If you are, delivering services through telephones and Zoom chats and such, you have access to your desktop or your laptop, and then you have lots of options. If you're on a smartphone, probably, and you're face-to-face with the client, probably makes the most sense to just take a picture and upload. But I'll leave the decision on which options to Marcia and the team. So we're going to go ahead and do this, and I'm going to go ahead.
Jim, before you move on, may I ask a question?
Absolutely.
So you spoke about being careful with confidential information and the case notes. Would it be appropriate if we did want to record how many children and just maybe their ages in that field?
Oh, absolutely.
Okay.
Yep. And that would be something for Marcia at a program level. Typically, for about 10 years, I managed American Red Cross's Coordinated Assistance Network, and a few years in the case management program. And all too often, case managers and caseworkers want to put too much information that isn't really driving services and creating liability for the clients potentially if that information was shared out inappropriately. So keeping them concise, focus on just the facts. And it's, as you had indicated there, saying, I met with the Air family. They have 2 kids, ages 9 and 12. They, were impacted by flooding associated with Ida. And, we're working on a recovery plan. That might be a completely appropriate one. Recording that, his wife needs thyroid medicine would also be like an appropriate area, but like citing specific conditions isn't really in service of the client or their privacy, but it's really a program calls to what gets in there. And typically the program will put guidance out as to, how much information and, what kinds of information should not be kept there. Is that helpful?
Yes, thank you.
Mm-hmm. So what we're going to do, I purposely removed 2 fields, as you probably just noticed, that are required. And then whenever you submit a form and there are required fields missing, it'll show up here. And the first thing most people do is they scroll and try to find it. We make it easy. Just click on either of those fields, and then you can select and submit. There is a, I believe, if that helps, I think me putting in, let's put in the other address. Submit. And we'll dismiss. So going through it, it makes sense every time you finish a tab, you get to the bottom of a form that you're hitting save. I believe it's set for a 30-minute timeout. So if you're working with a client, and you're doing this interview over the phone or on a tablet in person, make sure you're saving. I can check on the exact timing, but I believe our default setting is 30 minutes for you to be logged out. If for whatever reason you've got a form up like this and you've just put in the information and you got pulled away, you had to connect with the client because they were they're getting very emotional and you had to put the interview intake aside. One thing you can always do, and this is a little trick is right click on the home and open up a new page and log back in, and then you'll be able to continue with the record. So all is not lost. If you've gone more than 30 minutes and the information's still here, you can always open up a new window and log back in, and you'll be good to go and you won't lose any data. Now, the next thing we want to do is build the household structure, and then we'll do referrals, and we'll wrap this up. Some of this is covered in or included in the longer disaster case management form, the same household and referrals. So when we get to that, we'll save a little bit of time as we move through those things. So our household tool utilizes a case structure. So there is, it's effectively a virtual folder, right, for this household. Everybody gets their a single number. In this case, it's household ID 29. That becomes their case number. And I'll put in Jane. You do we do have a tool that requires you to put in every household member. So there is some double entry. We can remove some of that information from the intake screen, but it does allow for making sure you're able to report across the household structure. I'm going to hit save, and then and there's only one. There are 2 required fields there. Marcia, that might be something you want to look at a program level. Are there more? If I hit return to case right now, it will not save this information. So we need to make sure we're saving the information. Oh, and I put that in the wrong field.
Hey, Jim,
Yes.
one question. All this household information that you enter here, when you go into the DCM module and search for the client again, this information will be all available there as well and auto-populate?
Absolutely. Indeed. So it'll be as part of the household structure, just like it is here. And then I'll just confirm, figure out how you want to configure the search, whether or not you want to search across all household members or you want to restrict the search to the primary client. We can do either way. We see programs do both.
Okay.
Right now, I've gone through, I've built the initial intake, completed the initial intake, I've built the household structure, and now we're on the final part is connecting with other agencies. Here we have a lot of different options. Excuse me. We can search for a specific service, and maybe it might be financial assistance, it might be childcare, elder care, food pantry. We can also select by the categories. You can combine these. So if you're looking for durable medical equipment and access and functional needs, that would help you just get those. Or maybe you just want wheelchair or cane. So any of the different elements, those can be combined. You can also combine more than one area. The geographic area served, all the resources are entered in the system. The resource managers will define where that service is available. And this is a really cool part of being able to, let's say it's in Santa Clara, Santa Cruz, And you can see here, I can select the city or the county. And now I can search for all the available resources in both counties. Now, if I want to find areas in specific zip codes and cities, I'm able to do that. So there's lots of different options you have. It really depends on how the resource managers configure that, and that'll be set up as part of the training. And then finally, I can search by agency name. So let's say CADRE has some resources that are available. This is still, we're in a training environment, so we don't have a ton of referrals in there. So I'm going to go ahead and reset and search. So anytime I have a search, I can reset it and make sure I'm clearing all those so I don't have too restrictive of a search. I'm going to go ahead, and my browser got pumped up a little bit. Let me see if I can open it up. You can't quite see it, but it's fairly large on my screen. And I can select that when I select a referral. So these are recovery services. I'm going to select 2. The amount is $25. And this should be the total amount of that. And then you're able to put in when it was referred and when it was provided. Very simple, straightforward. If you're not tracking dates and you're doing more generic, you can just those two. If you need the specific dates, those can be provided there as well. So I'm going to go ahead and submit this referral. We submit referrals using the submit button, and it clears that. And you'll see down here at the bottom, it allows for me to see the referrals history from all the previous referrals, and that will grow over time. And that's it for the rapid intake. We're going to return to the landing page. I'm going to pause for a little iced tea and see if there are any questions around rapid intake. And then what we're going to do is we're going to search for that case we just created in the DCM tool, open it up, edit it, and explore the rest.
I have a quick question for you.
Mhm.
This is Tanya.
Okay, Tanya.
I'm wondering, when you're doing the referrals, so say I am referring somebody to Catholic Charities, to Aretha, for example, will there be a prompt for Aretha to go in and find that referral? Will there be an email that will go to her and say, hey, Tanya made a referral to you through Visionlink, for example, so that we don't have to go in and look for the referrals? We'll be notified when they're happening.
So we've currently set up with our standard referral process, but Visionlink has been supporting 211 operators for about 3 decades, and we have a whole host of other tools. One of the tools we have is active referrals that would allow for all that communications, whether it's going to the client or the receiving agency. So you could have any number of agencies you're coordinating closely with. They could receive an email when it would be a tokenized link that would allow them to log in and see the referral information, and then provide an update without a login. So we have things like that. And Marcia and Depenkar, if those are tools that you'd like to see, happy to set up a demo and you can see how they work. But we do have a whole host of tools that are available. Here we've got our standard disaster case management, which allows for resource management, the direct referrals. There are also ways of setting up guided search for referrals. So you may have 20 or 30 generally available services that don't need a referral that clients can walk in and access on their own. That is a tool we can set up, and that would allow also for emails to go directly to the client that would say, here's the intake process, here's where you go, here are the bus routes that are available that'll take you there, and those sorts of hours of operation. You need your photo ID and those sorts of things. But right now, that's our standard referral process just supports the sort of core, here's the service, here's when it was referred, and here's whether or not it was received by the household.
Maybe this is part of Tanya's question. So when you do refer to another service, they do not get notified unless we build that feature in. There's not like an email going to somebody in that service.
That is correct. So
So that has to
standard,
be built in as an added feature. Okay.
exactly so. Happy to discuss that further and
All
give you a demo.
Make a note of that. I
So
don't know, Tanya, if that was the nature of your question exactly.
Yes, it was. I think that would be really helpful in order to not have to go in and check if you have referrals. So just get an email with a link. I think that would be a preferred, at least for me, that would be the easiest.
Yeah, I'll make a note of that. So, yeah. Thanks,
Yeah,
Tanya.
we can set that up fairly quickly. Great, so let's keep moving on. We still have I think we still have another hour together, but still lots of ground to cover. I want to make sure we have all the, a little bit less than an hour. So here, again, I'm back at my landing page. Depending on whichever roles you have, you'll see different buttons. I've selected the DCMP search. I'm going to go back here. So here it is. We went to rapid intake, and the difference, you're able to see and search across all the different records here. This DCM search will take you to the landing page that has, or sorry, the form that has all those fields. So very important if you're trying to edit the disaster case management form, you use that search. And if you have others, you're using that search. I'm going to go ahead and search. And it comes up, and you can see here the case that I created will load. I can click on it there. And when this comes up, you'll see all the different fields that were in the rapid intake have been filled out. There are now new fields, and there are also new required fields. These can be set up completely different. A little orientation, because you have additional features here. The rapid intake is meant to be quick and concise and get the information in to provide, establish a case record, record the contact information, and capture vulnerabilities, as well as record referrals. The case management form that you're seeing here is designed to capture all the information across the recovery timeline for this household. So quick orientation, we've got our summary panel here that allows us to access information. As we add more information to the case record, you'll see more information show up here. We have the same structure around the subsections, the tabs. These tabs linearly go somewhat along, tracking with case management process. We also have,
can I jump in with a quick question?
Absolutely.
So on the summary, on the left-hand side on your summary, if you were to click on the interaction, is that a clickable link? So that would take you to that interaction so you could see what happened?
Yeah, it will take you to the, here that it would be the case note, and that would provide you the information.
Okay, great. Thank you.
Yeah, and I think we'll add a few more of these fields here in the summary template as we're continuing to refine. That was one area that we'll put in the, typically it's the first name, last name, FEMA, number of kids, number of household members. So as you're navigating across the tabs, you quick view of the case record here on the left. And I'll just update those today. And Marcia, if there are different fields, we have a standard sort of summary template. There are additional fields we want added there. Happy to add those. So we're not going to go through an extensive field by field, but we will capture the ones that have some unique features to them. First, anytime we need to update previously entered information, it can be corrected, adjusted here. We have the FEMA number, which is built based on the FEMA registration number structure. So if I have a FEMA registration, it will also, it'll be entered here. It will also prompt me if there is a exact same number in the system associated with another case. It won't take you to the case and it won't show you which case, but you'll be able to go back and do a quick search. You may find that, FEMA divorce, where two people are living together for any number of reasons prior to recovery, and they've applied for assistance under FEMA and they're deciding to go their separate ways. And you need to be able to record two separate registration numbers. You can just put a 1 in front of that number, and that can serve as this secondary registration number. So you can associate it with two different cases in the system. So it just gives you a little trick, or a tip rather, because you will end up with needing to identify and serve all those individuals, regardless of how they participated in that program. So next, we'll go through language and literacy. Here, we can select the different languages when that's able to write. Household composition, we can go the number of adults, number of children. We talked about that. In the first field, we're just capturing the household member. And now, actually, there's another child that wasn't mentioned, or another adult. You can adjust and reflect the current information that the client's providing for you. Again, it's all mobile responsive. If you're on a tablet, these will all appear in a column. I'll scroll back out. Next, we'll go on to date of intake. Client referred, lots of different options here. Who initiated contact, where the intake was, maybe it's a local assistance center. We'll select the client affirmation. Best time to contact, all the fields you would expect. We can continue the risk assessment. There are additional fields: household members under 18, considered low poverty. That one is presented as a Boolean, so you can capture the negative values. These are quick ways in which you're identifying characteristics of that household. Here in the assessment, we can go through and provide some more additional information, whether or not verification was obtained. Did you get a photo ID? Did you verify maybe you were there on site? Same is true for the pre-disaster living situation. And then level of damage, these align with FEMA's damage classifications. Number of floors, square footage of home, whether or not there was a basement. Also insurance coverage, select all that are applicable, and then go through and you can select the name of the insurance company. This helps because if you're working with a large group of clients and you're seeing, maybe it's just kind of a sense that a bunch of case managers are hearing all states denying a lot of claims, this would give you data. You could run a report and saying, yeah, actually, yeah, all the people with flood insurance were getting denied because it wasn't in their policy. Or you may find it's content insurance, and everyone else, all the other carriers are paying, but for some reason, whomever the company is, not picking on, it could be the Hartford, it could be any insurance company. That allows for a management level to be able to see those trends. And this was introduced by the Disaster Case Management Committee at National VOAD, because they were having such hard times sort of proving the case that with data that a particular insurance company was not approving claims in a timely manner, or maybe they were partially denying claims for administrative reasons. So it gives you visibility, some tools. You can put in some quick notes. This information was entered in the rapid intake. And then this is all the pre-disaster where they lived. This is where they live. So the current address, we can confirm that. Whether what their living situation is, you can have different identifiers, and you're done. So that's sort of the extended intake for disaster case management. And now you're going into like the program delivery. The heart of FEMA's case management program is the recovery plan. This is the the date that the plan was created, not when the goals were all met. Just, you know, you sat down, you've worked with the Perez family, and you've indicated that they've got, you know, these childcare needs, they've got work job training because they've got to go into a new area to get this a different job. You know, maybe it's repair and rebuild, maybe it's temporary assistance. You can capture all the information. So goals can be anything. They should be large. They shouldn't be something so granular that they get lost in all the recovery plans. So first, you can put in that there's clothing needs, and we select a category. Remember on intake, we had all those recovery goals. They show up here. This allows for you to, with limited training, you come in as a case worker or case manager, and you're able to quickly tag a case that has recovery needs. You're quickly able to search for referrals that meet some of those needs. And then also here, as you're building the recovery plan, you're able to select the recovery goals, recovery needs that track with those programs. Maybe it's start date, deadline date, and the goal status. Maybe it's partially met, and I'll save, and you'll see it appears here in a chart. I'm going to add another one. Maybe this is job training. Maybe it's a FEMA appeal letter, whatever the, can't remember if it's, yep, there it is. Adult education and job training, start date, and then the end date. And the goal is unmet. I'm going to hit save. And now we've got both of those together, and I'm going to hit that this one's completed. And save it. And you can see now I've got a nice timeline for the client to understand where they are and what their responsibilities. You could print this out. They could put it in their folder, their binder, put it on their fridge so they can visualize. And this is why you want to keep them very high level. Maybe it's, you know, maybe there's an assistance program like, you know, American Red Cross is offering financial assistance, but the deadline is on, you know, a certain date. You could add that here. So these are really, they could be a number of things. Should be high level so that they make sense as you see them at whole, but also tactical so that they're not overwhelming as you look at all the work that needs to be done. We've already done the referrals. We're going to go into advocacy. Now these areas all track with the sort of most common resources for recovery funds. You may have additional ones, whether or not they've been approved or not, the date of the determination, the amount received, whether or not there is an appeal status. You can capture all those, second, third, final appeal, not appealing. You can also coordinate assistance from long-term recovery group that maybe they got, you know, $300 towards appliances, or maybe it was $3,000 for a roof. You can capture those in there. And then finally, SBA loans, the total of the loan, and the date, and whether or not they've selected other types of loan. Maybe they've just secured a construction loan to supplement some of the work that was needed to be done. You can capture those other sources of income. Or
I have a quick question about that. So for the FEMA, some people are receiving more than one determination, so they could receive, you know, money for rebuilding their home, and at the same time they're also receiving rent assistance, for example, and that would be two different determinations. So how do you record that here?
That's a good question. As I understand it, most programs take the rent assistance because that is sort of ongoing money that's just, it's not really helping them recovery in terms of going towards the cost of repair and rebuild. It's maintaining their world. They're entering those as referrals. So you would enter in FEMA temporary housing assistance program, and you would put in the amount of money there. it's a good question. I've not seen that really addressed directly by a lot of programs, but I have heard that it's typically what they're looking for, is around the individual assistance. It's typically the funds that are applied more directly to repair and rebuild and recovery of contents and such. So lots of different ways. We can certainly add support for the different programs. We've just not heard that as a need from other agencies. Good question. Now, finally, we come to the case info tab, and we're going to go ahead. We're going to set this case as open. This is a new field introduced by, again, the National VOAD Disaster Case Management Committee. Always want to make sure to give acknowledgement. Is in FEMA's program, they love numbers, and they love showing the quantifying the impact and the progress of the cases. And typically, the FEMA reporting grid allows for you to count the number of cases you opened, allows for you to count the number of cases that have been closed, the number of agency referrals, number of people in the household, et cetera. You get the idea. But once you've opened a case and once you've entered a recovery plan, there's not a lot of indicators of where that household is. So what the case progression does is allows for you to say, well, I've moved beyond planning, and now I'm moving into advocacy. And once you've sort of exhausted all the resources, and maybe they're just waiting for the contractors to schedule the roof, and there's a blue tarp, and whatever the scenario is, maybe their work is largely done, they're almost moved back in, and you're moving into monitoring because they're resilient, they've got the resources that they need, or maybe the recovery process is largely done, the case management process is largely done, and you're just doing administrative updates to the cases prior to closure. This will give you the ability to indicate where they're at, which is really important for the larger programs as FEMA gets to the end of the 18 months looking for 3-month 90-day extension. Being able to show that you've got X percentage of these cases that are in any of these phases will help show where they're at. It'll also allow for ongoing basis as you ramp up the program to show how you're moving all those cases through the case management process. It's also a priority level that is assigned. Those track with FEMA's tiers rather than having them separate. Here I can assign a supervisor. Let's say it's and then we'll select the level of client contact. If we have any case notes uploaded, they would show here, and then will allow us for follow-up. Now, this follow-up manager is allowed to say, is designed to capture the next follow-up date, the status, and the follow-up note. These are not case notes. These are notes related to contact. So status is needed. Client says, call our aunt's house, here's the number. If it's scheduled, it might be, don't forget to remind her to do something related to the scheduling or something. You get the idea. If something's unable to reach, it might be called 5 times, unable to reach contact, something like that. So you'll be able to indicate. And finally, here's all the disaster case management fields. Intake, date release signed. Let me go ahead and move this forward. And was the case previously closed? If you're supporting a federally funded case management grant, reopening a case provides you makes that a new case for your agency, so you get additional credit. So important to capture that it was closed, and then you reopen the case, remove the closure date, and then update the intake to reflect the new SWAN. And that's it. I've got something I'm missing here. Love those little reminders. You just click up here, submit. And any questions here before we move into the last bit of the day? on the rebuild manager. It's been some good questions so far, so I get a sense folks understand. So now what we're going to do is we're going to move over to the, let me resize this a little bit smaller form. This is designed to work either, this is a construction manager tool, it's designed to work either alone or construct in conjunction with traditional case management. So you could have, so maybe you've got, a group of volunteers who are doing rebuild work. You could set up projects that are completely separate from case management. You can also assign them in conjunction with the case management process. What it does is allows for you to figure out all the different status, whether or not it's on hold for funding or if it's started. You can get a view, see who the case manager is, the case manager organizer, supervisor. You'll see here these total costs, actual costs are blank. Those will get filled in as we add work orders to our system. So as every project has an initial site visit and you project a date, you can also do the estimated completion date. Next, we're pulling up, this would all be read-only. This is all information about the client, and we can add more fields, Marcia, if there are more that make sense. And now we're moving over to the heart of the construction manager, and that is the work orders tool. What it does is allows for you to organize all the work by vendor or volunteer, organization, however you want to do it. If you want to break out, maybe you've just done, you've done a number of blue tarps in a community, you've handed them out, put them on, and so you just want to capture that it was a repair and the cost estimate. You can do valuations if you're trying to capture community impact. So if it's all community labor, if you're working with paid contractors and maybe they're charging you, $25 per blue tarp, right? You can actually then capture the actual cost. Maybe it's zero because there was volunteer labor. We can put in the estimated amount of time in hours. Maybe it's 4 hours, and permits are not needed. And here you can assign a contractor or a volunteer. So let's just say it's the Helping Hands of Santa Clara County, right? And then you can put in a phone number. Then we have a number of fields here that aren't really related, but maybe there's a note about the property you could put down there, and I can go ahead and save that. Now I've added that work order. Now the blue tarp is only going to do so much. We actually need to replace part of the roof. It needs to be roof shingles, right? So as I come in, again, it's roof, and then it's a repair, and then I can put in my cost estimate for replacing the shingles. So you can see this can be something big, it can be small. You can do something, maybe it's just, you want to capture there was a repair in the interior of the home and the basement and roll it all up into one thing that's $5,000 rather than breaking them out. However you need to do, if you're actively working with a number of contractors or voluntary groups, this allows you to see who's got access to, who's working on which projects. And here, this one's going to be $2,500, and it's like about, it's a crew of 5, and then they're going to go, and that there's not needed. And then maybe this is Pyramid Roofing, and then their phone number. And then here, the client was responsible for the labor, but the shingles were being donated. So they had to, capturing when it was requested, when it was received, work scheduled. And this is for each work order. So now I've got a number of work orders associated. These are all searchable. I can create a search for the contractor, for the type of work, for the address. And this information, as you saw from the button, is accessible directly from the case management's view. So if traditional case management services are being delivered and the construction services are happening out in the real world, the case manager is able to see with a click where they're at and understand and possibly intervene if there are issues. Now we're going to go back. We still have a little bit on the work order tab, but I want to show you here when I refresh this screen, all of my cost estimates now roll up. So now this is reportable. I know this is 24, 25. So not only for this particular household, but across all of the households. So you might, as a agency practice, you may have in the initial phase, you've got estimates. Maybe you've got Xactimate estimates on cost for materials and maybe projections of time. You could go through and add an estimate in there and allow for you to project those costs around the rebuilds. So as you're coordinating with unmet needs committees or perhaps local corporate donors, you can express the need in actual dollars for actual clients and help you better coordinate those services. Now, there are also, when we go back to the work orders, there are also ways you can upload photos. So this is really helpful for coordinating with voluntary groups. So if you want to provide photos of the exterior and you want them to do the flooring, perhaps they're doing redoing the kitchen, you can make sure that you're taking photos of what needs to be fixed and what needs to be focused on to ensure there's better coordination around the work that's needed. And also, if I'm a construction cost estimator and I'm handing all this work out, it gives me a good coordination tool. So now I can send confidential client information by giving them access to the system, and they would not see the case management information. They would just see the repair or construction related fields. You've got all the information in here. You can coordinate with public contractors, general contractors, you can voluntary agencies. You can even just track, the kinds of work that needs to be done so that you can figure out, how do you manage? You've got 500 homes, and how many of them need roof estimates? How many need plumbing estimates? How many need HVAC estimates? And then you can run those reports and batch them up and have contractors or voluntary agencies go out and do the work. Another thing that we've introduced here is it's sort of like an Angie's List for contractors. It's an approved contractor list. There's a tool to allow you to add agencies here. So maybe you want to make sure all of your roofers are licensed, bonded, insured. You can put that in here and that can show up in a list. You can also have any number of information around the kinds of services. This list could be available to case managers. So as they're working with the client, and maybe it's a repair that they're doing on their own dime, and they need to find a good contractor, or maybe they've suffered or been impacted by contractor fraud. This view would allow for you to quickly access information around approved contractors. There's also a switch in the back end. So if you're working with an amazing agency or a contractor and everyone loves them, and then they get inundated and they can no longer accept, you don't want to keep sending people there, you can just turn that off. So just lots of different ways to manage it, but the idea is providing good information, just like as you work and to identify referral agencies, working to find the approved, whether it's volunteer or whether it's traditional contractors, make sure all that information is available to them. Now here we'll go ahead and submit that. And here the workflow is set up for case management to return me back. Actually, no, this one's set up is to just save the record. And then we would add a button here to return back to the case record. Any questions around the repair and rebuild module? Marcia, we have a few more minutes left. What would be the best use of our time? I'm going to go over some quick searches, just to make sure we've got that sorted, but I think we've hit most of the high points.
I have a question.
Yeah,
So how do we download the data? Can we download the data into spreadsheets?
absolutely.
We do that.
We're able to go in here. And typically the export access is provided to supervisors. The search access on screen is provided to the case managers. I'm going to go here, and in Visionlink, everything's a form, and any field that you put information into, you can get out of the system, and it also can be used almost 99% of the time. There are a few exceptions. You're able to use those as an export function. So if you want to see all the cases managed by CADRE, you could select that. If you want to look at any of the application statuses, maybe you're trying to figure out, running appeals, and I want to run a report. What are all the cases that need appeals? If I'm doing a search for clients that might be in the system, I might want to start with a partial first name, date of birth search. I might want to start after that, confirm. I want to get an address search in there. So I'm going to go ahead and search. And this allows for me to quickly see all the different fields that are in here. So this looks right. Let's go ahead and do we'll just go ahead and do a quick export. So I'm going to go through here, and I'm going to run an export, and let's put in some constraint. And well, we'll just go with that. Well, I just want to hit export, and what I'm going to do is put my export name. What I like to do is put in the name of the export, or that it is an export, because this becomes the file name. And then maybe this is let's say this is a caseload report. These are all my clients. 09. And then I like to put the date in there, because as you run these reports over time, you end up with 50 of them or 100 of them in your downloads folder. And this will show you the most recent one or the most appropriate one that you're looking for. Now here's the next part. So the search form lets you select filter all the records that you want to appear, but you need to figure out, do I want to have, which export do I want to select to receive and format that information? Do I want to use the rapid intake? Do I want to use the disaster case management form? There will be very few of these available to you. There won't, or sorry, it's a different way. There won't be as many here to select from. A lot of these are only available to me as a super user. And then I can select export. So it's a two-part process. One, I select which records, and maybe I want all the records managed by CADRE. Maybe I want all the records that were denied.
So if I don't put anything in the case manager organization, will it give me all?
Yes, that will search across everything.
Okay.
And also, how can I search or download everyone that has expressed a specific need?
So give me an example. Is that a referral, or is that like a recovery needs?
Yeah, and a recovery need. I'm thinking, I don't know exactly what the fields that we can put in there are yet. I can't remember, but ideally we'd be able to put in, specific needs that are reoccurring. So, we had asked to add things like tree removal, for example. So if suddenly there's funding available for tree removal, I'd be able to go in and find everybody who said we need support with tree removal, download all of them so that I can contact them in bulk.
Exactly. So we have residential cleaning and debris removal as a recovery need, and then you could search that. Another use case might be maybe you're coordinating with disability integration, right?
Mhm.
And you want to provide a list of how many clients and households you're serving who have access and functional needs. Those are all broad way. It's a great way in which you're able to search exactly that. What are these high level categories? Because, you know, someone may have a, you know, I'm trying to think of a good example. You may have someone with a disability, but it's not presenting as a need, right? And having a vulnerability, of having a minor in the household indicated or vulnerability in the household, that is helpful for triaging certain things. But these recovery needs really track with actual presenting needs. So as I come in, it's not the fact that I have a 6-year-old in my household. It's that I have a 6-year-old in the household who has specific needs. It's not that I need adult education. It's that I have as part of my recovery plan. So they complement each other. Is that helpful?
Yes, that's helpful. Thank you.
And you can select multiple ones.
Yeah, I thought I added tree removal. So do you want that specifically called out from debris removal?
Yeah, it's different.
Yeah,
I would like to see that. That's an ongoing need.
okay.
Sure.
Okay. Any other questions?
I have a question. So, you know, as we're learning about, you know, at least we're in the process of contacting everybody that we were in contact with last year. And so right after the disaster, so as we're contacting them, you know, some needs are going to come up that are going to be, you know, they're going to be across the board. So some are going to rise to the top. How responsive is this in terms of adding needs to that list during, you know, kind of during the time frame that we're using this program?
Yeah, we can add those. That's sort of a change management question. You know, work through Marcia and what process she'll set up to request new recovery fields be added. They're super easy for us to use. The ones that have been there were in use in Texas and seem to meet all array of the 16,000 households they served. One thing to be mindful of the structures is, you know, think about how they all work together as a taxonomy and grouping those different items. You know, like the one example that was shown, go back around the debris removal, residential cleaning, debris removal. It may make sense to break that into two, right? Residential cleaning and then debris removal dash trees, debris removal dash yard waste or furniture or something, right? That might be a way of thinking about it. So you're organizing it so that someone who has as you're running reports and you're trying to identify those needs, there's clarity around how they relate to each other. So you get 500 client households that have cleaning and debris removal and 400 that have tree removal needs. Like it provides more, it may provide more clarity if those are broken out into separate categories. Just like you got housing, permanent relocation, housing, permanent reconstruction, housing, temporary. Those provide a way for you as you're managing that information over time to make better sense and better decisions. And it's easier to train as well when you're putting that. So just a thought. But as far as the tech goes, we can add any field that's not here. We can update any of the option lists. We can create and build, you know, through the authorization of Marcia and Dipankar. So we're here to support however we are. Right now, we've gone through the initial quick changes, and we'll be looking in the next week or two to circle back, collect some more, and anything that Marcia approves for me to do, I can update quickly.
Great, thank you.
I think we have about 10 minutes left. I'll have us keep thinking if you have questions, just some other housekeeping. So as you, over the next few weeks. If you have any issues with your user account and user permissions that you're unable to resolve, you can email help@visionlink.org. Visionlink, excuse me, help@visionlink.org is also available for support when something is broken or something stops working the way that it did previously. So these aren't change requests, these aren't suggestions, these are just, oh my gosh, I just went in and something that was working yesterday, maybe it's the searches aren't, finding anything. We tend to have pretty quick turnaround and not too many of these come up. But if they do come up, you can work through Marcia, and she can submit those to help desk when there are impacts to the system. You're unable to do your work because the referral module isn't, returning referrals, or maybe you don't, you're unable to, do something else because of a system change. Work through Marcia. The reason why is because if you're having the problem, probably others are too, and we want to make sure that she has visibility so she can reach out and say, hey, Visionlink has identified a problem with the referrals. Hang tight. They say it's going to be fixed in the next 10 minutes, and be on the lookout if it persists later, those sorts of things. It also helps, her just to understand when there are issues, and it keeps it easier for us because we need specific information when there's an issue with the system. And we'll work with Marcia over the coming weeks to make sure she understands all the different resources that are available. So if it's your account and it's a problem that you're having getting set up, help is available to you. Typically, once you've accessed the system the first time, there's really not, the only problem that presents itself is a lost password. And I will show that to you now. So I'm not signed in. I go to log in, and gosh, I'm just unable to remember my password. I can go through and I can use the forgot password link here. It will take me to a new form, and I'll put an error or whatever your email address is. This is the nervous part of whether I'm still not a robot. Now I go here. It's almost funny, right? So I go through here, and then I can submit this. It'll send me an email, give me a link. I select that, and I can then do the traditional login. Remember, as you're setting up your accounts, the passphrases are different than passwords. They should be something easy to remember, hard for someone else to get, verses from scripture, maybe your favorite song, any number of those things with spaces in between them. So let the good times roll with spaces, no caps, no funny squigglies or exclamation point, but let the good times roll. That is a valid password. Also, lead us not into temptation is also a valid password. So figure out what makes sense for you. The reason why that is that passphrase that maybe it was 2021, capital KITT, the number 3 NS exclamation point that you've been using, putting together some hard password that's easy to forget, having something that's easy to remember really should reduce the number of times you're resetting your password. So as you're doing that, I highly recommend using something that's meaningful to you, also using spaces in between words, and avoiding capitalization and special characters, because they tend to throw people the most. So that's kind of where we're at. We're almost at the bottom of the hour.